Well, good morning, folks. This is Daviess County Judge Executive Al Mattingly. I'm here to talk to you or give you a weekly COVID update. And before I do that, I want to introduce some special guests. Ladies being first, Amy Silvert is with us from the Green River Foundation, I think. Is that what we're called, Amy?
Green River Area Community Foundation. Yes.
Green River Area Community Foundation, and Doug Eberhart, who is here representing the United Way. Welcome, Doug.
Thank you, sir.
And I have Commissioner George Wathen here today. Commissioner Wathen represents Daviess County Fiscal Court on the group that oversees the distribution of COVID relief funds. Welcome, Commissioner Wathen. So let's get started. You want to put the first screenshot up, Jordan, and I'll talk a little bit about it. One of the things I do, folks, I always start the meeting by wearing my mask to tell you and show you how important it is, even though I'm here in the office by myself. COVID is still alive and well in our community. As a matter of fact, we had some uptick. Today, we reported 13 new cases in Daviess County, and that's been an uptick. We had gotten as low as 10.8 cases per 100,000 on the state's map. And Jordan, go ahead and put the map up. What I've got to show you is Monday's map, and because the state hasn't updated it with the latest figures from yesterday. But if you look, Daviess County is at 14.2 cases per 100,000. We had been below the state's overall current incidence rate of 12, but we've ticked above that. You also will look at one time, we were the only county in the Grad region that was in the orange. Now we've had two other counties join us again. That's Henderson County and Hancock County. Down in the lower left, the last red county to the left is Lyon County. That's where the Kentucky State Penitentiary is. They've got 149.6 cases per 100,000, and it's high because they've had a COVID outbreak. We have had so far confirmed in Daviess County 9,819 cases. I don't have the recovered cases yet because they haven't completely reported, but as of yesterday, we had 8,862 of those recovered. Today, we're reporting 175 deaths as a result of COVID. Some of those have been added by the state when they did a review of all the cases submitted. So if you would, just share a moment of silence with me for those Daviess Countyans who have passed away during this pandemic. Thank you. Lastly, as I've tried to do here lately, as of yesterday, there had been 40,000 first doses administered and 63,000 or roughly 64,000 total doses administered in Daviess County. Now you have to take that and look at it a little askance because not everyone that is given a shot or a vaccine in Daviess County is a Daviess Countyan, meaning that since Owensboro Health is a regional hospital, we have people coming from all the counties surrounding us, probably also from southern Indiana getting a shot. So, you know, on first look, it would look like 40,000 or 100,000 people are vaccinated. I don't think it's that high. So we take that with a grain of salt. But the good news is that the vaccines are moving forward. We're seeing less and less what's called vaccine hesitancy, which means people who are reluctant to take the vaccine. I know I've talked to a lot of people have done research online. If you have any hesitancy at all, I would suggest that you contact your doctor, your physician, and talk to him. On the screen right now, you'll see a list of 19 providers for vaccines. And I might use this opportunity to scroll through that a little bit, Jordan. But we talked to, there we go. That's the first 5. What's the next 5? Well, apparently we can't scroll. If you will go to Kentucky COVID COVID-19.kentucky.gov. That's KY, COVID-19.ky.gov. You will find a list of all those providers in our area. We now have Moderna, Pfizer, and Johnson & Johnson available. Most of the time, Johnson & Johnson is being provided by the health department, I think, right now. Jordan says that, scroll that back up, Jordan. Oh, I see it. He just sent me a list. You can actually find this information on the Vaccine Finder website, and all it is vaccinefinder.org, vaccinefinder.org. So with all that information being on, return us to the regular screen. What I was going to tell you is next week we are attempting to get some of the vaccine providers in here, and ask them, kind of tell us how they're allocated vaccines, how you can sign up, how long it would take. I really think that it's starting to go a whole lot smoother because we've been at this now since the 1st of January. I remember January 6th when Owensboro Health, somehow somebody put on the web page or Facebook that you could get a vaccine out there, and they filled the parking lot, filled the lobby, filled everything. But here we are 2.5 months hence, and we're doing an excellent job, I think. So with that being said, what I want to do is talk about the COVID Relief Fund that the city and the county, along with United Way and the Green River, whatever, put together, and trying to give some relief to folks, and particularly organizations and not-for-profits who took care of folks during the height of the pandemic. And we want to talk about it, talk maybe about how you could access those funds. And I also, at the end, if I forget, Doug, I want to talk about 211. So, Doug, why don't you start out? Tell us about the fund, how it came about, and the part that United Way plays in it.
Wonderful. Thank you so much, Judge. So when COVID first started and the pandemic first started, we realized that we were going to have challenges with our nonprofits. We recognized that services needed throughout our region was going to be really increased in request. And so David Rouse, the president here at United Way of the Ohio Valley, and Amy Silvert, the executive director of the Green River Area Community Foundation, came together and really started putting together a concept and a plan of how to respond to the huge needs that are out there in our community. And once they began to work together, they pulled together other foundations within the community and became a holistic one-stop shop for fundraising around that area. We've been very fortunate and very blessed in the community that in times of disasters and in times of great need, that we all come together and we really make a difference and make that impact. At the same time, we reached out to this county government, to fiscal court, and said, this is what we would like to do. This is what's happening. And the fiscal court was definitely on board quickly and effectively and said, we'll make a leading gift to this, and was a strong partner with moving it forward. And so throughout the months, as this thing has been going on, that partnership has stayed strong, stayed true. And as new needs have been identified, the COVID Response Fund and the committee members on that fund have responded appropriately, changed funding cycles, changed the way things are done to make sure that people are receiving the greatest help at the time that is needed. And it's very quick to respond. And so I applaud the Green River Community Foundation and Amy, I applaud David Ross, President of United Way of the Ohio Valley, in making that happen and having that vision to create. But even more so, I applaud and congratulate everybody in the community. From George being set there meeting, we talk about on the committee, if you'd have told us we were going to be meeting a year and a half later with the COVID Response Fund, we never would have dreamed it. You know, we thought we were going to be in, we were going to solve some problems, meet the needs, and then move on. Well, the needs are still there. And the COVID Response Fund is still going strong. It's still meeting needs every single day and really making things happen. So thank you to many of the partner programs, many of the foundations that are there.
Amy, so tell me about the Green River Area Community Foundation. I think I got it right because I wrote it down when Doug said it. Tell me, why did you guys join up? And I know when you were asked, it was immediate. There was no hesitancy on your part. But tell me why you thought that this was a good way to address some of the needs that we were seeing.
Well, part of our goal with the Community Foundation is to address the philanthropic needs of our nonprofits in the community. And we try to support nonprofits, whether through, small trainings we can do to help their leadership grow, or connect them with other donors, of course, is the one most people think of us at the Community Foundation for. So we saw, because we reach the whole community, we don't have just one sect. Some of our private foundations are focused on one area of nonprofits. And since we do not limit that in any way, we thought it was a good way that we could help lead this along with the United Way, and do something jointly, and it not be one of those cases where nonprofits are having to reach out and seek funds from 6 different funders, have multiple requests for the same items and needs. And so by us coming together and having our other philanthropic partners, our government partners, and as well as individuals and businesses to join in, it really made it, I felt like, streamlined for our nonprofits to seek funds.
Okay. Commissioner Wathen, I think that both of us would say that when we brought this to Daviess County Fiscal Court, there was no hesitancy on the part of the judge or any commissioners. We were all in at the very beginning. Why do you think it was so important that Daviess County step in and say, hey, we're going to throw a chunk of change into this?
Well, I think we knew that there were a lot of nonprofits trying to help a lot of people who were really suffering. In fact, you could tell that and especially in the beginning, as we on this committee, we would get these requests from these different nonprofits, and you could tell there was a lot of need, a lot of pain. There was some pretty heart-wrenching things going on for some individuals, and especially in the beginning, you could see there was a lot of it, a lot of problems. And through this program, and this money was raised, it's just another example of the way the citizens of Daviess County, whether it's the corporate citizens or the individuals, they step up and they help out. And through this systematic approach that was designed, I guess, by Amy and Doug and David, they put together this methodical approach and we've really helped a lot of people, and we always funnel it through the nonprofits. And it's really impressive. It's really, we've taken care of a lot of folks. And
I know you always give us a report at fiscal court about how the money is going, and how, initially the fiscal court put $150,000 in, the city of Owensboro put $150,000. So that's $300,000, but we had over $700,000 raised on that first phase. Where did the money come from, George?
Well, it came from the different corporations and the I guess there's some area foundations and different people, and I think the number is something like 78 individuals and 27 corporate sponsors of this program, and then the city and the county government. So that came from across the community.
That's pretty cool. That it in effect became a public-private partnership to provide relief to many people who are served by the not-for-profits. We keep talking about these not-for-profits, Doug. Who are they? Name a few of them. Who got money from the foundation?
So some of the big organizations that are funding are those who are dealing with housing assistance, rent, utility payments, and food. I think George summed it up. When the pandemic first started, we all recognized and saw how the grocery store shelves were bare and how nobody could find food. Well, that was impacting our nonprofits that give out food during food pantries and the food banks that were trying to supply food. These dollars actually ensured that people, the most vulnerable, had food to eat, and that food pantries were kept stocked. And so groups like Salvation Army, the Help Office, St. Vincent de Paul, many others that are out there that were really striving to get these things done. Catholic Charities was another group. And we also dealt a great deal around with the shelters, from St. Benedict's to Patino to Boulware to Oasis. We had weekly conversations with them about how to make sure that our homeless was taken care of and that they were safe. They had some place that they could eat and sleep and not contract the virus themselves. And then how do we manage the process of keeping them safe within a confined environment? And so all these conversations were going on simultaneously, and many are still going on today, just to make sure that those the most vulnerable in our communities are taken care of. That not only from a physical needs, but also from the mental and health-wise need. Make sure that if they get contracted the virus, what can we do? Where can they go? And so Crossroads was another shelter that we were involved in. So many different programs and many different agencies that were out there, that these funds directly changed the way they're providing services. The other cool thing that we saw with this fund is we encouraged nonprofits to think differently. If they were providing a specific service and it couldn't be delivered the same way, how can you still help those individuals? And so we had some services that totally changed. They began to feed people. They began to make different calls in a unique way. And so that was really neat. And it's all driven by this partnership, a public-private partnerships with foundations and businesses and everything coming together saying, this is what our community needs. This is what we need to strive to do. And by having that united front, people said, it's okay to be changing. It's okay to adjust to make sure people get the help. So it's been kind of cool. It's been a great process.
I think, again, public-private partnerships where perhaps the government provide that seed money to get things started, and then the private pick up and continue it is really, it's the way to go. And I think it's the way this community has always done. So Amy, you guys have been doing this for years and years and years, but probably just not to the extent that you got involved here. And tell me, one of the things I know when we talked about, we said we don't, as fiscal court members, as government, we don't want to reinvent the wheel. We're not used to doing this stuff. Let's partner with somebody like your organization. So how long has the foundation been dealing with not-for-profits and helping the community? Little known. United Way is always talked about because we raise funds and we campaign every year. We don't do that for your foundation.
Yeah, so we've been around almost 30 years and have been doing different grant programs through the years. It's changed and evolved over that time period for sure. But since I've been involved, this is by far the largest campaign, if you want to call it that, or, a focused area that we've worked on. And I think it's been so successful, like you said, because we had partners from all the sectors, and it helped, I guess, also give trust to these organizations that, so many people were bought into it, and that it was being administered with great care. Okay. So it's been great to be a part of that.
Commissioner, I know that one of the things that we always look at fiscal court is organizations who build silos. They want what they want. They're going to do what they want when they want it. And it's really hard and difficult to deal with folks like that. But I saw a lot of silo busting this time around, where there were a lot of folks who got together and focused on the common good of the community.
Yeah, I think it became obvious that the different organizations supported each other and worked with each other to make sure that the needs of the people were taken care of. And also they actually made sure that they didn't repeat themselves with any individuals. In other words, the individuals only had one source of funds that they were receiving. So there was a lot of cooperation. A lot of cooperation made this work.
That was one of the things that I was so interested in, and I think now we have a mechanism to do that, to make sure that multiple organizations aren't funding the same thing for one individual, because there's a lot of back checking and cross checking when we do that. So Commissioner, I remember one meeting in December when you gave the report. I think you told us, well, out of that $700,000, we got less than $50,000 left. So the recommendation, and I think you made the motion, that we give another $150,000. And again, there was no hesitancy, and the city matched that. How important was this second round in your mind?
Well, you know, as we were going along, we could tell we were helping a lot of people. There were still a lot of requests for help, and all of a sudden we could tell things were going to come to a screeching halt as far as being able to help people. But it was obvious that there were still a big need out there, still needs from folks. And so that's why we made that recommendation. And thank goodness more money came and we were able to continue to help folks along the way.
Okay. Doug, I know that, and we've talked about it, David and I have talked about it, and really the commissioners and I have talked about it. This need doesn't end at some point here in the next month or two. And even if we said the pandemic is over today, the needs are still out there. I guess my question is, how's the money holding out right now? Are you able to meet the requests and needs that you're seeing? Or are you back down to that point where we were in December?
We're not quite back down to that point. We've got about $137,000 left out of a total of $1.1 million that was raised. And but we do know right now that the community, due to the incentive package, the relief package that's gone out, we do know that people are taking that money and they're investing it, paying off their bills. But in talking with the utility companies and some landlords around the community, we do know that some people have exorbitant prices that they still owe on their rent and utilities. And so right now everybody's looking at how that's going to impact what the people owe. We also recognize that feeding is still a major issue. Even before the pandemic, we had 1 in 5 people that were hungry. We had 1 in 5 children and 1 in 7 people overall. And one of the things we saw through the pandemic is just with food alone is that the senior services group were serving home delivery meals and congregate meals. They are now feeding 3 and 4 times the numbers that they were before the pandemic. And so one of the questions we're having to ask for, look at toward the future, is what's going to occur when those federal dollars run out for home delivery meals? What number do we get back to? Is it realistic? How can we help those who were on a waiting list before now are not? And so those are the different issues of moving forward. So we know that even though everybody may get vaccinated, the COVID virus drops, the percentages drops and all those things. We know it's going to take us 1 year to 2 years to really get back into the swing of things. If you keep in mind the amount of revenue that was lost by all these nonprofits from not being able to hold any type of fundraisers or special events, we know they're not going to be able to recoup all that in the next 6 months to a year. And so we've got that impact, and what can they do with serving people? And so we're not out of this yet. And if you talk to the mental health professionals, they're projecting that we're looking at least 5 years down the road that we'll still be seeing issues related to COVID-19 and the mental health that was associated with it. So a lot of long-term impacts is what's happening.
Hey, Amy, tell me the impact on the not-for-profits that you normally work with. And I'm going to say probably you work with some new not-for-profits in this latest venture, but tell me the impact that COVID has had on some of the not-for-profits that you work with.
Yes, they've been hit with a double whammy. A lot of them, like Doug mentioned, were unable to have their typical fundraisers, any type of event or thing that they did to raise money in that way was canceled last year. But then they also were thrown all these extra expenses. They've had, in some cases, had to pay their staff extra time because they couldn't have volunteers in the buildings to help. They had to have extra expenses for all the protection and safety measures that they put into place to keep their clients safe. So what savings maybe they had on hand has been depleted. So they're really knocked them down to zero in a lot of cases. So like I said, their services have been so impacted. They haven't been able to, some of them bill for, the clients that they typically have because that's been reduced numbers. They've had to limit how many are in their facilities and that kind of thing. So They've really had it from all sides, their income and ability to raise money at the same time.
I know a lot of the shelters we had Owensboro Regional Recovery on last week before, and their revenues were tremendously impacted simply because they depend on courts referring people to them. Well, when the courts aren't meeting, guess what they don't get? Referrals. So, and then the county's expenses have gone up because when the courts aren't meeting, if you are arrested by the state for a felony offense or even a high misdemeanor, you don't get, you're going to stay in jail. And it's not by our desire. We'd love to see them out, but it's because the courts aren't meeting and they're not functioning. So tell me, Doug, quickly about 211. I know I've heard a lot about it. 211 seems to be the ideal thing because I know that we have talked in terms of using the 211 number in letting people set up vaccinations, notifying them when things are available. I know the county's going to get some utility relief for people who are outside the corporate limits of Owensboro. But we, again, as I talked to Commissioner Wathen, we don't have that expertise. We don't know how to get in touch with people, how to keep track of it. You know, somebody could submit 5 bills 5 times and somebody else not get anything because we overspent with that individual. Tell me how 211 works.
So 211 is an information referral phone number that you can call 24 hours a day, 7 days a week. And what you'll get if you need services of any type, whether that is for housing or hunger or for COVID-19 information, we strive to keep that up to date on a very regular basis as we learn new information about it. And thanks to the partnerships we develop, that's typically on a weekly basis, we update the COVID-19 vaccination information. So anybody can call 211. You go to greenriver211.org and access the services and look at it. When you make that phone call, what you'll get is a live person, and they will share with you the top 3 locations of your choice of what your need is. If you're looking for utility assistance, they'll give you the top 3 choices that's as close to your zip code as possible. They can give you what you need to take with you, and then you tell you how to go about seeking assistance. And so we're able to track that. But the great thing about 211 to me is we're able to track the number of services not met. And so we're able to find out, let's say if we have 100 people call for utility assistance and we only meet 90% of that, why didn't we be able to meet the other 10%? So it's a great number to call anytime you need services and access to services.
Okay. Commissioner, I think you would agree with me. In Owensboro and Daviess County, we have a lot of people who are not knowledgeable of all those services that are available out there. And that's why 211 is so important. And I have in the past encouraged people to use 211, but you hear about local governments not taking care of the homeless. I don't think anyone that's sitting here today would say that we don't invest in helping homeless people, that we don't take care of the hungry. I don't think there's anyone here who would say that. The problem is that a lot of times, many of our not-for-profits, the services they offer either overlap or they are so disjointed in getting the information out that our community really doesn't understand what a great community we have, what a caring and giving community that we have. And I can tell you that we are just simply from the fact that lots of other cities and counties give homeless people bus tickets to Owensboro because they know when they get off the bus that we'll take care of them. And that's not just anecdotal, that's talking to our homeless shelter operators. That happens all the time. So Commissioner, anything that you would like to add before we go?
Just thank all the people who participated and especially those that donated money. It was, I think it's been an extremely successful program, and I'm just proud to be part of it.
Amy, anything that you would like to say? Now, this is a time where you shamelessly plug your organization and ask for donations.
Well, first I have to thank the fiscal court because your all support has definitely helped make this successful. We couldn't have gotten it off the ground as quickly as we did, if at all, without your support. So thank you. And we really appreciate your confidence in us and helping us get this going, because it has changed and impacted lives in our community.
Okay, well, I want to say thanks to all the commissioners on fiscal court, because as I said, there was no hesitancy. And I want to thank Commissioner Wathen in particular, because when I asked him to serve as liaison, he did so willingly and kept us informed. And I think it's pretty cool, again, as I said, when public and private can work together. Doug, I'm going to leave you be the last. First of all, I'm going to say that I know United Way's revenue has been tremendously impacted by this. So tell me what people can do to help the United Way help other people in our community.
Okay, so United Way covers a lot of different territory and areas. If you'd like to make a contribution to United Way, you can go online to uwov.org and make that contribution. If you'd like to make a contribution to the COVID-19 Response Fund, there is a button on there that you can make a contribution to that fund specifically, and to make sure we are continuing to meet the needs within the community. You know, United Way funds over 56 programs throughout the region. And so if you have a desire and a project that you'd like to get connected with, please let us know. We'll be happy to connect you with what you have a passion about. And finally, to say that this community has been very blessed with the leadership of the fiscal court and with the leadership of others that are around that's really made this difference in our community. And we could have not have been successful. And I say COVID-19 Response Fund has been successful because the leaders within our community coming together saying, this is a good thing. We need to work together for the benefit of our community. And that's what this fund shows. So thank you all for what you've done.
Well, and that's a good segue to end. I want to thank everyone who had anything to do with it, and all of the citizens in this community. As I said, we're a very loving, very caring, and very generous community. Sometimes when people look from the outside in, that's what they see. Sometimes within our community, we know where all the little pimples and blurbs and blips are, and you'll hear us raising Cain about this or raising Cain about that. But if you compare us, I would compare Owensboro and Daviess County to any other city and county in the entire Commonwealth, if not without. So thank you for what you've done. Keep up the good work, and we'll be talking to you later down the road.
Thank you. Have a wonderful day, folks.